working as a professor of radiology and in charge of breast imaging and interventions in Sri Ramachandra University, Chennai. I would like to tell all of you that how important it is and how easy it is to get into the interventions. Okay, there are a lot of people who talk about interventions, but I'll be simplifying the thing by just telling you that how I started doing CT guided interventions and how simple they are and how useful they are to the society and how beneficial they are to the patients when we give them the diagnosis with such simple procedures which we do and which are very safe actually. See, you take FNSE for an instance. All interventions started with simple thing, fine needle aspiration, which is done with a simple 22 to 24G, a simple needle, and what you have to do is you have to know the right technique. If you know how to do it, you can prove within half an hour to the patient whether the patient has malignant cells in the specimen or no. Okay, that gives kind of a assurance to the patient, and that apprehension which is there for the patient's relatives and also to the referring surgeon whether this mass which we are labeling as a malignant is there or no. So cytology, FNSE will tell us at least whether the malignant cells are there or no, and it takes only 2 minutes to do it. Now coming after FNSE, how the interventions developed is we started doing core biopsies. Core biopsies, we have different kind of different gauges of needles. Now for example, I'll tell you that I usually do a lot of breast interventions. In breast we use 14G now. Okay, it's a 10 centimeter needle with a 14 gauge, and it's a very simple. We have automatic guns, semi-automatic guns, we have coaxial systems and all that. Okay, and it is really easy to do. You have to follow simple principles. For example, in breast we just follow that the needle, the core biopsy when we are taking it should be parallel to the chest wall. As you all know that under the chest wall you have a lung, so you don't want to shoot it vertically and go into the lung and cause pneumothorax. So you have to follow very simple rules. Okay, and they are very easy to do if you have learned it in a right way and you do it in a right way. They are very, very easy to do. Okay, now after these core biopsies, I'm talking about breast. Now we have migrated to something called vacuum assisted biopsies. The advantage of vacuum assisted biopsies is that it gives us a lot more tissue as compared to the core biopsy needle. So when we give a lot more tissue to the pathologist, they are very happy and they give us even more definitive and full diagnosis. So basically what I'm trying to say here is all the young budding radiologists, they should come into the intervention, learn it the right way, and I'm sure all of you can do it and will be helpful for the patient and for the society. Thank you.